Welcome back to Holistic Healing Association. Today we're here to talk about addiction. I have Hazel and Babs with me.
Hi, I'm Hazel. I am from Canada and I work at a treatment center and I'm a social worker by trade. I support families with residents of our families. And we sort of because we believe that addiction is basically a family disease. So the more we support the families, it's higher chances that the person will succeed.
And Babs, would you like to tell us a
Hi.
little bit about yourself?
Yep, sure. Hi, I'm Babs. I'm from Adelaide in South Australia. By daytime, I work as a barista, which brings me a lot of joy. I'm joining this conversation today because I am part of a family who has a son who has 10 years of addiction. So I've been supporting my son for a long time. He hasn't been at home for a long time, but he is actually home right now with 15 days free from meth. So right now it's a good day.
That is a good day.
Yeah.
How does that make you feel?
I feel it's a myriad of emotions. I feel happy. I feel hopeful, cautiously hopeful. And I'm very happy for my son that he's reached this point and I was able to have him back home to go through this process rather than a rehabilitation centre that hasn't really worked too well for him in the past. So this is something new, but it's so far so good.
Okay, well, I'm happy for you guys.
Thank you.
Yay.
Can I ask you, what is addiction?
Yeah. I mean, for me, addiction is more like anything, any substance, any behavior, anything. I even call it behavior, right? Because it's not only substance. So anything that you take or do that causes you harm and still do it anyway. So it's one of those things sometimes. That's what I call it. Like it causes harm to one person and it still continues to do it in the first place.
And what type of addictions are there?
You have the substance and you have the behavior. From my understanding, is substance use is like anything, alcohol, drugs, or anything that they could actually take in. I think sometimes even food is more of an addiction, right? Behaviors are more gambling, sex, relationship, codependency is even an addiction. So it's like thinking too much, spiraling, right? When you think too much, that's also an addiction. Anger is also an addiction. So that goes on the behavior side of it. So when a person gets into that system, when they continue doing what they're doing without in the 12-step program, it's more unmanageable life already, right? And they still continue doing it.
And what causes addiction?
So many different things causes addiction. I mean, whatever, like if you present it in a way, addiction is like an energy. Like I've heard it one time, right? Addiction isn't like an energy waiting for a target, right? So when someone gets into the addiction side of it, once they get stuck in the addiction, once they stop, you have to be careful what they're replacing it with because they could replace it with anything else if they stop substance use, right? Because for us, the only thing that we know as addiction is, substance use, right? But really, there's a lot of other addictions that's available here.
And how does addiction impact an individual?
Can I help with that, Babs?
Yeah, for sure. I think it's a very slow and slippery slope of just not being able to function in a productive and healthy way. They become very isolated, can be suffer with mental health very badly. And that's always my experience with my son is that the mental health and the addiction sort of coupled each other, but it's been very hard to find anywhere to treat both together. It's been a very long road of starting out with maybe curiosity on his part with marijuana, and it wasn't long before the marijuana use became excessive and damaging to his mental health, to his physical health, to our family's well-being, and then really every other drug imaginable has been part of his journey, and it's been for 10 years. So I suppose for me, I've seen my son slowly disappear into his addiction, and I miss my son.
I'm sorry to hear that.
Mm. Yeah.
But he's 15 days clean.
He is.
And tomorrow will be 16 days.
Yes, it is. And he's very proud of himself. I'm very proud of him. And who knows, you never know what's going to be the trigger for a decision to be made to stop using. I think for Josh, he was homeless, he was couch surfing, he was living really rough, and it was starting to become too difficult for him to maintain any sort of life. So he said, I think I need to stop taking meth. And I'd never heard those words from him for the time that he's been on meth, which has been about on and off about 3 years now.
Right. Well, that's a huge step forward then.
Yeah, it is. It is.
And how has your son's addiction impacted you and your family?
Hugely. Yeah, so family life has been really, really difficult. Josh's dad, my first husband, passed away when Josh was only 9 months old. So for the longest part of our life, it's been me with 2 sons, an older son, Alex, and Josh. And yeah, it's just been, while I was very uninformed about addiction, it was chaotic, totally unmanageable. Life at home was really, really hard. And sort of things started to change for me when I started to learn about addiction, seek help for myself. Well, I did a lot of seeking help for my son, and it turned out to be the arrow turned around and the help was needed for me so that I could be in a better place myself to cope with what was happening in our life. And things started to improve, but it's been, I feel like I live with ongoing trauma because addiction brings a lot of chaos, is the word that comes to mind that feels right for me. There's a lot of chaos that comes into a family home, and it's very, very difficult to find any peace, any respite, to know what any day is going to bring. Yeah, it's really hard for families.
I'm sorry to hear that.
Mm.
And on top of that, is there a stigma to addiction?
Yeah, definitely. Certainly a stigma to the person suffering with addiction, because their world becomes very small. Josh has lost a lot of friends, lost jobs, lost relationships, been very detached from family, and a real lack of understanding is, why doesn't he just stop? Why doesn't he just stop what he's doing? Can't he see how it's affecting everybody? But that's ignorance speaking. And then there's also stigma for me, people who don't know what to say to me, or maybe cast judgment on me, on my parenting, that my son could, be in a 10-year battle with addiction. People are very quick to blame someone and maybe need someone to blame. So yeah, the stigma is, it's huge, because the average person is very ill-informed.
And
That
that's the
must be
thing,
really,
right? Yeah, sorry about that.
I was just going to say that must be very tough. Sorry, Hazel?
Mm.
No, it's just the stigma itself when Bob's talking about the stigma, right? Like as a family member for one person with addiction, it affects a lot of family members, right? So if you look at that, and then the support that we get sometimes is only for the person with the substance use or the person with a problem. But what they don't see is like a lot of us as a family members don't get supported because we should know better. And then the isolation as well, being as a family member, because you don't have anyone to go and talk to that understands because of because of this stigma again, like shaming you of having a child with having a son with addiction. And it's very isolating, which is very sad as well. Yeah. Sorry about that. Yeah.
And what do they get from the addiction?
There's a lot of things that they get, right? People use this for a reason. Okay, so when we're looking at addiction, you asked earlier, what causes addiction, right? There's so many different aspects of addiction. It could be, depends on what a person believes, but for me, it doesn't really matter because it can be intergenerational. It can be the environment. It can be like trauma. It can be childhood trauma. So there's so many different ways, but like in the end, all you have to see is they are using for a reason. So understanding what they're using in the first place, understanding where it's coming from, making sense of the behavior, right? So where are they getting it? What are they getting from it? There's one teaching that I had is like, what is right about the addiction that they're not
Mhm.
getting for themselves?
Exactly.
Yeah. So they're getting something. So when you're talking to a person with addiction, it means something like, okay, how are we going to be able to support this person? I know it's hard to stop, but at the same time, it's their coping mechanism. It's what helps them to actually, there's so many reasons, they fit in, you know, when they're drinking, they fit in. When they're using, all of a sudden they're like, you know, they know everything and all this kind of stuff. It builds confidence. They have friends, they have people around them when they're using, right? So, or when they're sad, they use because it gives them that relief, right? So there's so many different reasons for people. So finding when we're helping people with your son and all this kind of stuff is going around and understanding, okay, what's the substance use giving you in the first place? So how do we actually, you know, replace that? It's a coping mechanism again, right? How do we replace that with that? With a healthier habit or a healthier behavior? Did that answer your question?
No, it does very much. Thank you.
Yeah, and I think as well, for someone who is struggling with addiction, what might start out as a coping mechanism, maybe if I look at my son, I remember as him finishing school saying he wasn't ready to grow up. He wasn't ready for what life was going to bring him. And soft drugs at that point gave him confidence to face a world that he really wasn't ready for. But he was he was probably one of the people who was not going to be able to do it socially, or, you know, realize that it wasn't a good thing to be doing as much as he was. There's a very big family history of addiction. There's generational addiction in the family. So he was probably one of the percentage of people who it was going to end like this for him. And, you know, it gave him relief, it gave him confidence, it gave him what he needed, which was just to cope with every day. But everybody looking in saw it very differently, because it's right what you said, Hazel. They get confidence, but it's not how we would get confidence when we feel good about ourselves. So it's like watching a movie and you can't change the story because it's their story. It's not your story.
And what can help an individual become clean?
I think based on okay, it's understanding, okay, compassion. It's like, you know, we need to basically understand where they're coming from. And sometimes it's how we deal with people, right? I run a family program at the treatment center where I'm in. So we support family members. And a lot of times there's the expectation is very high, right? Expectation, because the projection as well of what we want from them. Okay, so if we remove all of that and we basically just let them want to have it, because from my understanding, no one will stop using, or no one will stay sober unless they want to. Okay, so our job is to actually support them in any way we can, support the loved ones, but we never support the addiction. Okay, because even though we want them to get sober, when they're not ready, it's very, very difficult. So our goal is for them to understand, or for them to see that, you know, the reward of using is getting them into actually a lot of trouble, like, you know, like physically, like a lot of damage, physical, mental, emotional, even spiritual, right? So all those things that's been affected. So our job as a family member is let them know that the struggle is real and we're here to support you. We understand that it's hard, but how can we support you to actually move from here to there? And then when they see that the reward of being sober is higher than the reward of using, then people change, right? No one changes until they see that they get something. Because as I mentioned earlier, they're getting something from the addiction, right? They're getting something from that substance. So how do you replace that with a healthier? In order, it's like, you know, it's positive rewards. It's like kids. We're giving them something. So what are they getting if they stop? How are they going to get what they're feeling when they stop?
And how is a person's nervous system when they normally become addicted?
That's fair. That's a lot of do you want visuals? So what we do, okay, when it comes to addiction is like rewiring, right? Addiction, when it becomes really, really deep in addiction, it rewires your brain, right? So it creates a pathways where like one of the teachings that I had is it creates a pathways where it stunts the growth of it stunts it's a learning pathways. So if we're using it in addiction, then it rewires everything, right? It's like our behaviors. So it's when you say it's trauma, right? It stays in our brain. So it's basically it's got a pathway. So the only way, the more we use it, the more it gets bigger. It's a neural pathways, right? So if the more they actually use, the more they drink, the pathways gets bigger and bigger and bigger. So the only way for it to stop is to create a new pathways, which is a healthy behavior pathways, until the substance use pathway gets smaller. But remember that it's always going to be there, right? So it's like riding a bike. Okay, when you're riding a bike, the more you ride a bike, the more better it gets a lot easier. You just keeps riding a bike. You don't ride the bike for a long time, your memory doesn't it's you don't ride a bike for a long time, but it's still there. You don't forget it. It's always going to be there. So once you start riding a bike again, all of a sudden it opens up and you know how to without even thinking about it. It's exactly the same thing as addiction. So as sort of like, you know, a person in recovery, they have to be able to constantly reminding themselves that, you know, it's still there and it can get bigger again. Is that making sense?
It makes sense. Yes. Thank
Yeah.
you.
Thank you.
I have a good analogy that that I use, and if I use and I have spoken to Josh before I came on here and said, "Are you happy for me to talk about you?" He said, "More than happy, Mum. It's fine." Early in Josh's addiction, a family member passed away, and we were at the funeral, and Josh is my emotional child. So I have one child who's he's a academic, very scientific, very not so emotional. Josh is very emotional. And we were at the funeral. Josh did not shed a tear, showed no emotion. He was totally numb. And I remember looking over at him, feeling really worried myself that he was in the state that he was in when everybody was crying, and he was he wasn't feeling anything. And I have to say, for 10 years, he really has been numb in his feelings. And if I think about his nervous system and what I've learned from countless counselors, psychologists, professionals that I've seen with Josh, is they liken it to a a highway of roads, and we're all on the road driving along, and you know, you'll go turn a corner, go over a bridge, and in Josh's brain, the damage that is being done is the bridges are collapsing very quickly. So his pathways are very broken and damaged, and he's still in that car driving, falling into potholes, falling off the edge of bridges, and really not aware of it. It's becoming his norm.
Mhm.
And so when I think of Josh, I think of his brain being really damaged from the drug use, and I live in hope for him that the pathways can be recovered, the bridges can be rebuilt, and if he, with the addiction, because it is will be a challenge for him for his life, that if he sees a pothole, he avoids it. And by following healthier behaviours, by finding better things to do with his time, by recovering. And I do believe that he can recover fully. But 10 years of drug use does cause a lot of damage in a person's brain, and their nervous system pretty well shuts down.
Yes, Hazel?
Just to add in on that one, Babs, you know, they have this thing called neuroplasticity, right? Where brain can recover. So like there is hope in a way, just to sort of like emphasize that there is hope. It just takes time. It just takes a
Yes.
lot of, it's like learning to, you know, I always use this, you know, who's driven a trailer, right? You know, it's like learning to actually learning new things, learning new stuff to make sure that the brain gets rewired, because it's going, if even though, because you were saying that it's already broken, right? The bridge is broken and stuff, the roads are broken, so all you have to do is go around that. This is when you're rewiring your brain, as pathways goes around it, so it gets better and better and better, and goes around this broken stuff. So brains are really, really very intelligent stuff, you know. It recreates its own. Like all the trauma that we have is our brain actually protecting us, right? So yeah, there's there's hope of being brain recovering. Yeah. Thank you.
And how does an embodied processing help people with addictions?
I mean, it's more from my understanding of EP, right? So it's looking within, we have a lot of stored trauma in us, right? We have a lot of things that we haven't really processed. So what happens sometimes is we'll keep on doing and doing the same thing. And so embodied processing just releases those stuck, I call it stuck energies within us, right? So when we process it, it gets released, and that's when we actually heal, is when all those things gets released from us. Watching where we're feeling everything, right? Because EP discusses how you actually look at, you know, where you're feeling it, you know, are you feeling it in your chest? Is it in your jaw? Is it in your stomach, right? So finding where the trauma is stuck, and that's how are we teaching us to actually release those trauma in
So
order for
processing the trauma.
processing the trauma in order
And
for us to sort of like move towards healing. Because
what
again,
percent,
remember,
sorry,
And I think, I think when someone's been in long-term addiction, it's been so long since they've felt anything, because of course the substance numbs their body, numbs their mind. The feelings do start to come out once the substance use stops. And I think EP is, is just such a great way of helping someone who is so out of touch with their feelings not be overwhelmed by the feelings when they're starting to come out, helping them learn to sit with the feelings and giving them strategies of being with those feelings, feeling them, hopefully letting them pass. And it gives them the confidence to face the next day when the feelings continue to arise.
And what percentage of people that struggle with addiction do you believe have trauma?
99.
99%?
99.9.
99.999, right? So
Yeah.
realistically,
Yeah.
trauma it can be very, very little thing, right? I remember when I did like even when with Gabor Mate and all this kind of stuff, trauma can be a very, very small thing. But the perception of a child, they think it's big. So they create some sort of like wall, they could create some sort of like, coping mechanism that's not, even though it's not true, they believe that it's true. So, I mean, again, addictions, if like I mentioned earlier, they're using for a reason, right? So sometimes it's to cover those traumas, right? What are they feeling? They don't understand what they're feeling, so they basically use just to actually cover up for those kind of feelings that they have.
And what advice would you give someone who's struggling with an addiction?
Just keep doing it. Like keep finding reason to actually you have to find a program. Again, for me, right? You have to find something that you could actually follow through. You could do EPs just to release all, but understanding what's behind their addiction. Okay, if they don't understand what's behind their addiction, it will be very, very difficult to heal, right? Because stopping substance is only stopping the substance. Then they're not actually dealing with what's behind their addiction in the first place, right? They started using in the first place, whatever that reason is. So figuring out what that reason is, which is working with EP practitioners, is very good. Understanding what's behind those and heal from that. And then eventually addiction, they will not have, from my experience, once they see the reason of why they're using, they're not going to be using in the first place once they heal from that. They won't be needing that because they have a better, healthier lifestyle and they're getting something from it.
And what advice would you give to families that are struggling with addiction?
Oh, okay. Families, I know, I mean, I'm not sure, for me, okay, families get so consumed by their loved ones, okay, and that's understandable because they are your loved ones, right? But I think Babs mentioned it earlier, is creating your own life, right? It's like your loved one will have their own life and you have your own life, and prioritizing. Again, family needs to prioritize their well-being, because without prioritizing their well-being, they won't have anything left, because they'll be so stressed, they'll be so angry, they'll be so frustrated, they won't have anything left to support their loved ones. And what are they giving the loved ones if they're not looking after themselves? So making sure that you prioritize as a family member, prioritizing their well-being, then they are able to support their loved ones when they're ready.
It's like putting on your mask if the
Mhm.
airplane's going down.
Yeah.
So you can take care of your loved one.
Yeah.
Yeah, yeah. I think if I can just add on both points in regard to the person struggling with addiction, I think I would really say don't lose hope to that person, because they're living in a very hopeless situation and often can't see any way out of it, that this is their lot in life and I can't survive without what it is that I'm using to help me cope with life. So just to know that there is hope and that they can recover. For a family, I would say most definitely looking after yourself. I spent a lot of years overwhelmed, burnt out, trying to find so many different avenues to fix my son, and none of it worked because it was all about me wanting it for him rather than him wanting it for him. And once I started focusing on myself and getting myself okay with the situation I was living in, everything really did calm down and settle down, and my relationship with my son got better. And I do say to Josh, still to this day, I am always here for you. I'm here to help you get well, but I'm not here to help you stay sick. So that's my boundaries, and often it's really hard to hold those boundaries, but I've gotten very, very good at it. And right now, what Josh, he's been to rehab 3 times. He's been in a lot of like mental health wards in hospitals, and this time he said, I just need my family, because he's really lost everything. And I've said to him, I'll always be here for you when you want to get better. And he said, I just need my family. And we're 15 days.
You're a good mom.
So it's, so it's listening to him, to what he needs, but still being really strong with my boundaries as well. And reach out to the person struggling with addiction, reach out. For families, reach out, get support, join groups, do study, inform yourself. It's
And
the best
inform
thing
your
I've ever done for myself. Yeah. Yeah.
Thank you both for joining tonight. I'm sorry to our viewers if the internet connection wasn't always as good as it could be. In February, we will be having an expert guest speaker who happens to be a Catholic nun who has started a new order in the Catholic Church, and her mission is to train nuns around the whole world to help people with trauma. Thank you and good night.